There are multiple types of hernias that are possible. You have abdominal wall hernias in the middle of your belly. You also have groin hernias. These are all treated surgically. Unfortunately, there's no medical way of treating these, and they get worse, not better. These are treated by either an open technique where you have a big incision in your belly, or by minimally invasive methods with small incisions, either robotically or laparoscopically. My preference, whenever I can, is to treat these hernias minimally invasively. This is because it reduces your pain and improves your recovery, so you're able to go back to living your life very quickly. And most importantly, it gives me as your surgeon better visualization to ensure and improve the long-term success rate of the repairs. Most of these surgeries are done as an outpatient, where you come in and you go home the same day of the surgery. But with the abdominal wall hernias, or the ventral hernias as we call them, I usually do recommend spending an extra night in the hospital, just because the pain can be significant afterwards. Gastroesophageal reflux disease, or heartburn, is a pretty common problem a lot of people face. It's essentially because the muscle at the bottom of the esophagus, that's to prevent acid from going from the stomach to the esophagus, is not functioning properly. So that causes you to feel, especially when you've had certain foods, a burning sensation in the middle of your chest. This can be treated both medically and surgically. The surgical option comes into play when the medical options have failed, or if it shows that categorically this muscle is not functioning properly, and regardless of the medications, you're still having persistence of your symptoms. Another reason why surgery can be an option is if the acid is irritating the lining of the esophagus so much that it's changing in its nature and its looks, and puts you at risk of cancer. The options for a surgery is essentially creating a new or an increased tightening at the bottom of that esophagus to prevent the acid from going up. Here at TGA we do that. We do have both the surgical, or the laparoscopic or robotic technique, and we do have another technique called the transoral incisionless fundoplication, where we do the procedure via camera in through your mouth, an endoscope. These procedures have great success rates in improving heartburn and acid reflux, and once done, we see a significant improvement of symptoms with most patients, such that they don't need the anti-acid medications anymore and they're feeling much better.